Hi guys, I'm just coming through with another quick video talking about antibiotics today. As you may know, I put up a post yesterday talking about antibiotics and antibiotics resistance because I feel inspired to share my knowledge on this and make sure that we reduce our antibiotics use because there's only a finite number of antibiotics available, so that when you do need antibiotics, the chances are that it's going to work for you. So yes, antibiotics have revolutionized healthcare. They save lives every single day because they fight bacterial infections. When people think about needing antibiotics, it's usually for a urine infection or a chest infection or an ear infection, commonly known as an upper respiratory tract infection. But for these respiratory tract infections, the majority of the time, it's actually a virus that causes it rather than a bacteria. So, at the time when you go to a doctor, you might have had the infection for a few days and they say, okay, we're going to give you antibiotics. And a lot of the time when people take the antibiotics, it's at the same time as their body's immune system starts to fight a virus. So it may appear like the antibiotics is working, but really it's their body fighting at the same time, and they would have gotten better on their own even without the antibiotics. So I think it's important for people to know that. Now, I'm not saying don't see a medic if you're unwell. It's actually really important for an assessment to be done so that they can recommend, a management plan. And sometimes we use a delayed antibiotic strategy. So we may say, we think it's a virus, but there's a small chance it could be a bacteria. Take this prescription. But don't cash it in. Unless you have A, B, C, D, E symptoms or you don't get better by so many days. Frequent and unnecessary use of antibiotics can lead to a population-based kind of distribution of resistance and personal resistance. So it means that in a certain area, when people get urine infections, it's likely that a first-line antibiotic such as amoxicillin will not work because all of the urine infection bacteria in that area have kind of mutated to become resistant to the bacteria. And a personal resistance would mean that, say, if you have amoxicillin quite a few times, the bugs that you get are now resistant. So when you have amoxicillin, it's not going to work. And this can make things difficult because some people are allergic to whole groups of antibiotics which already resists the kind that they're able to use. And there's only so many types of antibiotics. Once that list has been exhausted, we're actually screwed. And bacterial infections that are not treated and go on and cause sepsis can actually lead to death. So we really need to save the antibiotics that we have for when we really need it, so that when it's given to a patient, we kind of feel confident that they will respond. People die every day of infections, and we're so lucky that we have antibiotics readily available, but we just need to be more mindful about how we use it. So, if your doctor advises no antibiotics, please trust them on this, but always, call for a reassessment if your condition shall change. I really hope this is helpful so that people can understand why doctors are quite careful about prescribing antibiotics, because we're trying to help you and also help kind of the whole population. There are so many other side effects. Antibiotics can lead to sickness, they can lead to diarrhea, they can lead to kind of killing off all the good bacteria in your gut, and for women in your vagina, leading to kind of like upset stomach or thrush. So the final point is trust your doctor if they say no antibiotics. Thanks for listening, guys. Please like, share, comment and subscribe. Bye.